Good afternoon and welcome to the daily briefing here in St. Clair County, where Sam Bierman and Chairman Mark Kern will be giving their reports, and then we have questions and answers scheduled for this lovely Sunday. Sam?
We've got good numbers again today, so we're going to keep our fingers crossed that we can keep this going into the week. So as of today, 9,273 tests have been performed in St. Clair County, with 1,450 positive test results, which is an increase of 10 from yesterday, and that does include both males and females from their teens to their 70s. Currently, we have 7,805 negative test results, with 18 results that are still pending. We do have one additional death to report today, which brings our total to 106, and that was a female in her 80s who did have unknown health conditions. And as always, our sympathies go out to her family. For those that have completed the required 14-day IDPH required quarantine, we are at 973. For state totals, 1,042,774 have been tested, with 127,757 positive test results, which is an increase of 867 from yesterday. And we are at 5,904 deaths for the state, which is an increase of 43 from yesterday. For hospitalization numbers, and these are for hospitals that are in St. Clair County, currently we have 52 patients that are admitted due to COVID-related reasons, and 5 of those patients are on ventilators. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Brea of Belleville has 42 cases and 4 deaths. Brea of Cahokia has 8 cases and no deaths. Caritas Family Solutions in Belleville has 12 cases and no deaths. Caseyville Nursing and Rehab has 3 cases and no deaths. Cedarhurst of Shiloh has 12 cases and no deaths. Cedar Ridge of Lebanon has 17 cases and 1 death. Colonnade Senior Living in O'Fallon has 5 cases and no deaths. Four Fountains in Belleville has 104 cases and 25 deaths. Help at Home in Belleville has 2 cases and no deaths. Help at Home in O'Fallon currently has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 8 cases and 1 death. Lebanon Care Center in Lebanon has 54 cases and 10 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. New Athens Home for the Aged has 52 cases and 3 deaths. St. Paul's Home in Belleville has 42 cases and 12 deaths. Swansea Rehab and Care has 25 cases and 3 deaths. And TDL Incorporated in Belleville has 4 cases and no deaths. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. So, we've talked about testing. Everybody's doing a good job. We have tested 1,926 additional people since the 1st of June. So that's a large number. That shows everyone's getting out, taking this seriously, getting those tests. And of those tests, 193 people found out they were positive. So that means that they're able to then quarantine at home, make sure they're not spreading COVID. All of that is the way we're going to get through this. So let's go into the zip code reports right now. Remember, if you don't hear your zip code, it doesn't mean that you don't have a COVID positive diagnosis in your zip code. It simply means that we haven't risen to the level above 5 yet. Additionally, there will be some negative numbers here. A couple of the zip codes are going down today. That's because things change, people move, wrong zip codes are given, and we always take those numbers down to make sure that we're as accurate as we possibly can be, because that's why you're looking at us every day, because you want to hear the straight scoop. So here, the zip code report for today. 62059 remains at 7. 62201 remains at 25. 62203 also remains at 47. 62204 goes up by 1 to 51. 62205 goes up by 1 to 59. 62206 goes up by 2 today to 124. 62207 goes up by 2 to 83. 62208 goes down 1 to 83. 62220 goes up 2 to 149. 62221 goes up 5 today to 126. 62223 goes up by 1 to 58. 62226 remains the same at 160. 62232 remains the same at 28, as does 62239 remain the same at 15. 62243 is also static at 8. 62254 goes up today by 1 to 53. 62257 remains the same at 12. 62258 remains the same at 15. 62260 goes down by 3 today to 12. 62264 goes up by 1 to 48. 62269 goes up by 2 to 82. And 62285 goes up 1 to 16. So we're going to turn this over to Herb.
Yes, and I'm going to turn it over to Brian. As I said, it's the question and answering Sunday for us, so those of you that have taken time to ask your questions, we will try to have an answer for you. If we don't have it today, we will get it for you. So, Brian, thanks again for joining us.
No problem. We'll start with some health department questions that came in. Sam, the first one says, are the nursing homes being tested? We have heard you say they are, but it seems like it's taking a long time from talking to people that I know works in some of them.
So there is an ongoing effort across the state to test all of the long-term care facilities, and that is also true in St. Clair County. We are testing all of the long-term care and congregate living facilities within the county. Some of those facilities have chosen to go through a private lab, and they still have to give us their results, but that's something that they've chosen to do. And this testing will continue under the guidance of IDPH until we hear differently from them, and we will continue to follow their guidance for this testing.
Well, Sam, I think it's worth mentioning to our followers that your department is calling those long-term health care facilities on a daily basis.
We are.
And that is kind of making sure that their needs are being met. So
It's really a dual purpose call. Number one, to check and see if they have any new test results, because as we said a couple of days ago, they're kind of like we are. You know, they're running on fumes. They might be running short-staffed. So reporting their numbers to us might not be on the forefront of their brain. So, you know, we're just giving them that, hey, reminder call. Did you guys get any new results today? If they are positive or negative, situation behind them. And then, as you said, to check in, see how they're doing, and see if there's anything that the health department can do to be helping them out.
yeah, because you're still furnishing them with the PPEs
We
and
are.
stuff like that. So
Exactly.
It's good, very good.
Sam, another one that came in and says, I think many people, including myself, are confused about the different types of testing. Would you explain the types of tests that are available and which ones should be taken to receive which results? Additionally, are all of these tests being put into the aggregate of numbers tested?
So the three different types of testing that is being done through all of the testing facilities in St. Clair County. The first is what is called nasal pharyngeal, or you might see it called NP. And that is the swab that goes all the way up, may make your eyes water, may make you kind of cough. That is being done at the Memorial drive-through facility off of 159 in Swansea. The second is what is called an oral pharyngeal, or OP, swab, and that is the one that they stick into your mouth and kind of swab in the back of your throat. That is done at the Southern Illinois Healthcare Foundation locations that we have for testing. And then the third is what we're calling the nasal swab, and that is done at the Cahokia Walgreens. And while that is a nasal swab, it's not the one that's going all the way back. It's staying in essentially the first inch or two of your nasal cavity, and it's being the sample is being gathered there. So those are the three different types of tests that are available in St. Clair County. And yes, all three of those, no matter what kind, those are all added into the numbers for the positive and negatives that we give you. Now, as we talked about before, they also have a serum test. And that is, again, not approved by the FDA completely yet. They've given it an emergency use authorization. So we do still count those numbers, but that test, remember, is only telling you if you've had it in the past. The first three tests that we talked about are the ones that will tell you if you currently have COVID-19.
Okay, thank you. One more question while we're here is, do you keep track of the difference between residents and employees that have had the virus in long-term care or nursing homes?
So yes, as we just talked about, when we call all of our long-term and congregate living facilities every day, when they give us their test results, if they have any positives, what our staff is going to ask them is, we're going to ask for the name, if they're a staff or a resident, If they are a staff member, we're going to ask for their contact information, because then that is how we go about doing the contact tracing. It gets passed off to someone in our COVID team that is doing the contact tracing, and they will reach out to that individual and get all the information they need and do the extensive contact tracing. So yes, we do keep track of whether they are staff or residents at all long-term care and congregate living facilities when we get test results.
But just to clarify, what we release and what we'll continue to release is per the IDPH guidelines.
Correct.
Not breaking. You guys are aware of that in your facility, but
Yes.
it's not broken down.
Correct. The numbers that we provide and we do the updates for cases, that's all you will see it as a whole. We won't be breaking them down into staff or residents for the briefing.
Thank you. Chairman Kern, a couple that have come in here for you. First one says, I live in New Athens, and our county representative was asking about the numbers in our area. His response was that elected officials have not been informed of anything regarding the virus. Can Chairman Kern explain why that would be?
Well, so we've been doing this briefing for the past 80 days. It's available to everybody. I know specifically, I give a shout out to John West, a county board member from the O'Fallon area, who is a faithful follower. He's on every day. If people are regular viewers of this, they know that Mr. West signs on early and is always there with appropriate comments and questions. And of course, he is a very active county board member, so we would expect nothing less of him. In addition, as to New Athens, we do a weekly briefing with all of the mayors in the county and have done that since the beginning of this. We share numbers at the time, and we talk about the needs of communities. The mayor of New Athens is extremely active also. In fact, he's been here himself, concerned about the nursing home and the people in his community. He actually has come here and picked up PPE himself. So to hear that comment that supposedly came from a county board member, it puzzles me a little bit. This information is all out there. It's made public by us every day. At the county board meetings that we've had since COVID started, since about May 14th or so when we started doing these, we have given reports at the county board meeting, laid everything out. A number of the county board members have been here and come to our EOC and actually have taken PPE to their districts, to their community. It's been an active process. So anyone who wants to be a part of this, who needs any information, there are many sources to get that, and it's available just by a phone call or by turning on your phone and watching Facebook.
Okay. Next one that came in says, do you know if we may be able to move to the next phase before June 26th?
So we pursued moving to the next phase early in the last phase, and we worked through the state to try to make that happen. We do think a number of our concerns were heard. We're monitoring these numbers now. They're not as good as we'd like them to see. I think we're really going to have to maybe start to analyze that a little later on in the process. The numbers continue to be a little higher than what we'd like them to be, and I think it's because people are getting out and we want them to get out. We got to see how that works. We got to see if people getting out is going to cause us to go backwards. We do not want to go backwards. It's everything that we want is to move on to the next phase. That's where we're headed, we believe, but we've got to remember to wear the masks and do all those things to be able to get to that next phase.
Well, Chairman, I think it's important to mention there have been things that weren't initially in Phase 3 of Restore Illinois that because of review and concerns have been allowed. Just recently this week we saw the new guidance come out on swimming pools that they were allowed to reopen for groups of 10 or less for like swim team practice, lap training, and exercise. So I think we could still see some minor modifications.
I think the state's listening, and the churches specifically, that was a pretty big change in policy, or at least amendment of policy that allowed churches to gather, and that's important for the community. They understood that churches are our fiber, and so they allowed those particular things to happen. They continue to actively monitor this, and as we said, it's all got to be based on science. These are decisions that are being made by the medical community, and we're going to continue to follow those recommendations.
Okay. And one more while we're here. When reporting your zip code numbers each day, are these active cases or do they include people that may have already recovered from the virus?
So what we have is cumulative numbers in our report. So these are all of the people in your zip code who have had COVID and have been COVID positive. Recovery rates for people vary. We've heard that they vary greatly from the medical community. And so we feel that the most accurate number to give you is that cumulative number. And that's why we report the increases every day and the decreases so that you know that on that day, that's a new diagnosis and likely for the next 14 or days or so that person is going to be COVID positive in your zip code if that's where they are.
Thank you. Director Simmons, a couple here. First one, just a statement. The person wrote in and says, I want to express my appreciation to all the briefing members for having Mr. Anderson tell his story yesterday. It was so heartwarming to hear a positive side of the terrible virus. Team St. Clair is really the best thing going on in this county.
Well, and it was a good addition yesterday to have Mr. Anderson and his daughter on. Some of the comments we've seen yesterday was that it was good to put a face with this story. And again, our thanks go out to him, and we wish him well on his recovery. I mean, he looked well, but like he said, it's still a learning, and he's got to do some things. But we appreciate him doing that.
And the fact that, I mean, he has recovered and he's home, but he's going to be taking medicine and he's got to gain back
70 pounds.
I mean, he lost a lot of weight. So it is this virus is a tough thing. Once you recover, the recovery goes on and on past.
Well, and for him to be open about it, I think really says a lot for him and his daughter and his whole family. I mean, the lieutenant governor has reached out to him, wanting him to be part of a task force, because to get somebody to come on and tell what you went through, and I mean, just to hearing him explain that, being on a ventilator for 15 days, I mean, is remarkable that he came off of that. So.
Okay. Director, as it relates to the social media that we do every day with these briefings, the next person writes in and says, it's sad that people make suggestive comments and personally get attacked. Therefore, I will no longer partake in the comments for that forum. I will always be for Team St. Clair, but it's sad that some are trying to ruin this for the many.
Well, and I answer as many of those questions as I can. Sometimes till 1, 2 o'clock in the morning, I'm answering them. So when people wake up the next morning, I feel they need to get an answer. And they are right. There are some on there that no matter what we do, and as the chairman said, we've been doing this now over 80 days, and we've tried to be transparent, we've tried to be accurate. But what I've come to learn in these 80-some days is you're not going to make everybody happy. There are still going to be people out there that think it's the flu. We heard Mr. Anderson say yesterday it's far more worse than the flu. So I've came to the conclusion that we're not going to change those people's mind, but for those who are following us and who do appreciate us being transparent to them. And again, as we said, we're that source of information. We have been. We don't have the news channels or the news media knocking down the door to get that word out to the public and our citizens. So that's why we started this, and we'll continue to do it until we feel that there's no need for it.
Okay. And one more, as it relates to the briefing, says, I've watched other mayors appear on the program, but can you tell me if the Belleville mayor has been on?
Well, as the Chairman Kern said, we do a weekly briefing with all the mayors, and they've all been invited, but they've all got their own stuff that they're doing. So he hasn't been on, but if he would want to, we'd make room for any of the mayors. Like I said, we've had the mayor of O'Fallon, the mayor of Shiloh. But he hasn't been on, but if he wants to, we'd be more than glad to.
And we've had the fire chief.
Fire chief from Belleville was on here, Tom Poor, Chief Poor, and he's the one that is out there on the forefront too, but we continue to do that.
And to the mayor's credit, he's been on all of the mayor's calls.
Sure,
I believe on every
week.
one.
Every week, and he's done some of his own messages, so for those of you who follow us, you can check out any of the local mayors. The mayor of Marissa has got a weekly PSA that he does, and he's actually been on here with us too. So and we've said this, all of our first responders, all of our political leaders in the county have been in this thing from day one.
Very good. Okay, go back to Sam with a couple more health department questions. The next one was, one of the criteria for moving to phase 4 is a good hospitalization percentage. Can you explain how that percentage is calculated?
So the hospitalization percentage measured, it includes not only COVID positive patients that are confirmed COVID positive, but also those who are have COVID-like symptoms that have either been tested and are awaiting results or waiting to get tested. And that data is calculated by the Illinois Department of Public Health on a 7-day rolling period. And the hospitals are also monitored to make sure that they keep a 14% bed availability for, I believe it's ventilators, ICU beds, and then medical surgical beds. So certain types of resources that we need to make sure that we have a certain amount of ready at the wait.
Okay.
Well, and as you know, we get those reports daily, and that's what we've been reporting on. And as Chairman Kern said, and you've said, Sam, those are really the numbers that we're watching. If those hospitals become full, then we know that we're doing something wrong.
Yeah, so that's one of the reasons that we give the hospitalization numbers and the ventilator numbers to you guys every day, because that goes into the calculation of where we need to be to move to the next phase.
Okay. The next one says, can you start telling us how many test results come back each day as well as the positivity rate? They continue by saying, I know we can figure it out, but since the positivity rate is one of the factors, it would be helpful for it to be included.
So when I got here today, I did read that question, and we will review that and see if it's something that we can possibly add to the daily briefings that we do.
But I think it's important to understand that while we are looking at those positivity rates for our county, it's the southern region
Yes, it's not
positivity
just-
number that needs to be considered, which is released every day by IDPH.
Well,
Exactly. We're
yeah.
not just St. Clair County.
Exactly.
There's a lot more that goes into us moving on to the next phase other than, what's happening right here. It's, as Brian said, as a southern region.
And I want to point out that you don't just wake up in the morning and say, oh, I'm going to wait until 3:30. I mean, there is work being done all day long, sometimes all throughout the evening. And it takes a lot to put those numbers together.
It does.
And everything has to come in. We try to get them done ahead of time. There's sometimes we're running around here like a chicken with a head cut off at 3 o'clock to get ready to give the followers the most up-to-date information. So it's not like you're sitting around doing nothing.
No, I wouldn't mind that, but yeah, that's not the case.
And it's all information that you have to verify.
Exactly.
So these numbers, you get raw numbers in, and then you've got to verify to make sure everything's correct. There have been
Exactly.
multiple occasions where we've had to take a look, make another call, just to make sure the numbers were accurate.
Exactly. And, that's just part of it. You get new numbers. You need to make sure that what yesterday's numbers said and what today's numbers said, making sure that everything equals out. So it's not just receiving numbers, it's doing some calculations and looking at the big picture.
Okay, one last question on the health department side. It says, it seems the governor is encouraging negative or symptom-free people to get tested, which is being used to influence reopening.
So the reason that we have asked people to go out and get tested, even if they aren't symptomatic, is we are starting to see, we have been seeing a very high number of people that have been getting tested that have been coming back COVID positive without having any symptoms. And our only goal has been to, stop the spread and flatten the curve of, spreading this virus. So that is the intention behind having everyone get tested, to simply make sure that they are not out unknowingly spreading the virus to potentially those that could be harmed most by it. So that's why we're asking everyone to go get tested.
Okay, thank you, Sam. Chairman Kern, a couple more here for you. One is, why isn't there a testing site on the east side of the county?
So we received money from the state of Illinois. The grant, I think, is being finalized right now, which is for not only tracing but also additional testing. So we're going to be opening up mobile testing sites to be able to go to people where they have trouble with transportation, where we get to those pockets of people that aren't being tested for transportation reasons, and also to open it up, to the whole county so that they don't have to necessarily travel as far. We hope to get that moving in the next couple of weeks. That's the goal, and I agree that more testing sites are needed.
Okay. Another one says, if the numbers you're watching daily continue to rise, is there anything that could cause us to go back to phase 2?
So I think that's unlikely, highly unlikely, but if there would be a significant new outbreak, increase status, if the positives would rise in a meteoric fashion, if hospitalizations rise in a sustained fashion so that the hospitals become overrun, I think then it's a possibility. But as of now, the way we see our increases going, I think likely it's going to be that we will be moving into phase 4 and not moving back into phase 2.
And that's our goal, is to go into
That's the
phase
goal.
4.
But I think a good point behind that was that's why there was some significant concern by members of this panel last week when we hit that high day of 74 hospitalizations.
At the highest day since April 15th or 14th.
Had we sustained that number over and it didn't fall back off to where we are today, today we're down to 52, so we've got back down. But had that number stayed up, it kind of meets that concern of what's occurring.
That's why we just have to be vigilant, do the things that we've been doing, encourage others to do that, to wear masks, to wash your hands, to all the things that we've been talking about for the past 80 days. They have held this spread down, and now we've got to get to the point where we get to a significant cure or vaccination, and then we'll be able to get our lives back to where they were before.
Okay, one last question that came in for you, Chairman. It says, do you feel our area should be as open as it is? I've seen many not following recommendations of the CDC as it relates to distancing and face coverings. Also, many in large groups that were close together and were already decently impacted by this virus here in St. Clair County.
That's the reason why there are measured steps to move from one phase to another. That's the reason for the waiting of 28 days, to make sure you have enough time to see, things have opened up a little bit, loosened up a little bit. What is the effect on that, and was it a mistake to do that, or is it a righteous move? Is it a move that is acceptable, or are the numbers still acceptable? So. Do I think that things opening up is a good thing? Yeah, I do. I think that people needed to get out. Humans are social people, or we're social beings, and I think opening this up has kind of let a little of the pressure out of the kettle, and let's just keep doing what we're doing. But if they wear the masks, and we do those, wash our hands and do the social distancing, we can make sure that opening up, we even open up further and further until, as I said, until we get to that stage where we're back to where we were before all this started 80 days ago.
Well, Chairman, I think we got our own destiny is what here. We can either continue to move forward in a good pace, meet that phase 4, or if we don't do what has been recommended, then everybody who isn't doing that is guilty of that. I mean, so we've got our destiny laid out for us. Wear your mask when you're out, social distancing, and you can be a part of the solution. If you don't, then you will be part of that problem.
In our perspective, on moving on to phases, so we were cooking pork steaks on the day that I got a call that said we've got our first COVID positive person in St. Clair County.
Yes.
And now there are, 1,450 positives. We've had over 100 deaths. I mean, this process has been pretty agonizing for everybody to get through. That's why we don't want to step backwards. Everybody has really, for the most part, done what they've been asked, and that's why the numbers are where they are.
And that's why we want you to continue to do what has been asked of you until we can get the vaccine or whatever. We know our life has been changed. It's been turned upside down. But now it's the matter of how long it's going to be that way. So let's get into phase 4 and then get the vaccine, and then we can get back to cooking pork steaks.
That's it.
Director Simmons, one last question that came in here for you. With the all of the peaceful protests that took place in the county this past week, do you think there will be an increase in cases, as it appeared there were many not wearing face coverings?
Well, first of all, I want to thank everybody who did go out and do the peaceful protest. I mean, that says a lot for our county, I think, Chairman. I mean, we were fortunate, and everybody who partaked in them, thank you very much. Yes, it is a concern. When I saw some of the crowds weren't with a face mask on, but we will monitor. That's what we're doing daily, and time will tell. Let's hope not. Our fingers are crossed. But that is a concern, just like we're concerned about the Memorial Day weekend. We saw a little spike, and the next probably week to 2 weeks will tell us if any of these people who were out doing the protest, if that caused a problem for us.
Okay. Next, we're joined by Susan Sarfati here with St. Clair County Superintendent of Schools. We, as you've been joining us here on Sundays, because we never know what kind of questions are going to come in, and we did get another school question here today. And the person wrote, has there been any changes or determinations as to when or if schools will return in the fall?
Well, yes, we did get some new guidance from the state board on Thursday evening, both concerning summer school and concerning school starting in the fall. As we talked about earlier about how things change and how we've seen some changes in phase 3. Previously, we had been told there would be no face-to-face summer school, but now, as of Thursday, schools are allowed to have face-to-face summer school as long as they're in groups of 10 or less. And there are some pretty strict guidelines as far as cleaning, hand sanitizing, social distancing, using those PPEs that we have been talking about for 80 days. But there are also some other things besides just that classroom summer school that are now permissible. Behind the wheel instruction, we have a lot of young adults that are ready and willing and want to get that driver's license, but they still need behind the wheel hours. That's now permissible. Things like the early childhood and special ed screenings that are done with really young children are now permissible to be face-to-face. And school registration can be face-to-face, but they also have to have a component that would be done virtually or electronically in some way. As far as school opening in the fall, there are 20 pages of guidance that we have to look at. But honestly, if we're not in phase 4, I don't see how we'll be able to open in this fall. So we are very, very hopeful that we will be in phase 4 and able to do face-to-face instruction.
Great. Well, we appreciate. And so driver's ed now is a go.
Right. The rules say that no more than 2 students in a car with an instructor. All the touch points, the steering wheel, the seat belt, all those things have to be cleaned in between. So it will take longer to do. And behind the wheel is the lowest teacher-student ratio out there. So it's going to take a while to get everybody from the spring semester and summer semester through those requirements.
But driving, man, that's important when you're 16 years old.
I remember.
Me too. Barely, but I remember.
Just a couple years ago, right? Yeah.
What was your first car, Herb?
Oh, a 1955 Plymouth.
How about that? Okay. What color?
Pink.
All right.
Yeah.
I'm through with you.
Me too. I don't know why, but that's what it was.
No comment.
Long as it ran.
No, there, yeah, it ran. Sometimes I had a good friend who was a mechanic. There you have it, our Sunday afternoon briefing, our question and answer. I hope we were able to answer your questions. If not, leave them, and we will try to get you the answer to them. Once again, we're going to be here until the need isn't there. When Chairman Kern says that he feels that we've all done our due diligence, then you won't get to see our smiling faces, and you won't get to hear me complain about do this and do that, wear your mask. So we'll be back tomorrow at 3:30 for the next briefing, and Cindy and Daisy will be back momentarily to translate this into the Spanish communities. Thank you, and have a good rest of the afternoon.